Hey, welcome everybody. My name is Steve Pomerantz. I am a health insurance broker. And what's unique is I grew up in this industry through my dad being a doctor, medical director of hospitals, and created a Medicare plan in 2023. So very unique experience and facts. And I'm all about facts when I do these live. So let's begin. 2025 is a very unusual year. And in 2025, let's go back. In April of this year is when always Medicare comes out and accepts the bids from the insurance companies. And the insurance companies didn't expect their payment was going to be as lower than usual. So the insurance companies then came out with their bids to Medicare. And so Medicare goes, whoa, we didn't expect that. So for 2025, Medicare is giving a subsidy to the insurance companies for the prescription plans that go with those who have a Medicare supplement plan, or also called a Medigap. And so we're expecting those prescription plans, the formulas, to change still. Some places and some states are losing a lot of prescription plans. For example, in Arizona, they're going from 23 down to just 9 choices. And some people have lost their prescription plan, so they are forced to change. And one thing about seniors is that one thing they don't like is they need to change. And unfortunately, in 2025, that's going to happen. Across the country, we are seeing Medicare Advantage plans leave different counties, different states. So a lot of people are going to be forced to change their plan, but it gives them what's called a guaranteed issue. So if you've been on a Medicare Advantage plan for a very long time, you can go on a Medicare supplement plan at no health questions. For example, I'm a cancer survivor. So if you've had cancer and you want to go on a Medicare supplement plan, there are no health questions. You're guaranteed to go on it. And then you can get a prescription drug plan as well. So for those that have been forced to lose their prescription or their drug plan and their Medicare Advantage plan, they also have a special enrollment that is longer than the traditional annual enrollment, which is October 15th to December 7th. And for the impact as well is from the Reduction Inflation Act, the donut hole, is also called the coverage gap, is going away for the first time in the history of Medicare. So since April, we've been seeing what the effects of that's going to be happening for people that have been in the donut hole as well as not. So for 2.7% of the country, which is about 3 million-ish people, this is going to be really, really good for people that have spent thousands and thousands of dollars every year, because this year their max out of pocket, what is also called a troop, will be $2,000, which is great. But we're also going to see prescription plans formulas change as well, become more restricted on their formula. For example, sometimes there might be step therapy, which you have to take different steps towards a prescription plan that your doctor would like you to take. Also, there's going to be prior authorizations as well. We're going to see some prescriptions sometimes not be approved at 90 days, and they might only be approved at 30 days. So a lot of changes. And the reason why was Medicare came out and they want to change the prescription plan, which is great. However, by changing the drug plan for 2025, the plans themselves, insurance companies, are losing profit because Medicare usually got 80% within the prescription plans, and now the insurance companies are going to be taking on more liability. So what we're going to see is different formulas change, as well as Medicare Advantage plans across the country disappearing, also good benefits going down, bad benefits like copays and hospital stays and ambulances and specialists. And some plans might be not having as much dental as before or losing dental altogether, as well as drug deductibles. So the standard drug deductible plan, which is called a basic plan, is going to be with a deductible of $590. This is for people who have a standalone prescription plan, as well as people who have a Medicare Advantage plan. And within standard, they're going to have tier 3, tier 4, and tier 5. Now remember, there's 5 tiers normally. Sometimes plans have 6 tiers on the prescription formula. So we're going to see some tiers, a tier 3 be 25%, a tier 4 be 25%, a tier 5 be 25%, and the standard basic prescription drug deductible is going to be $590. And for those who don't have a $590 drug deductible, those are called enhanced plans. And what we're going to see is that for the new rules, you have a maximum of $2,000. And if you don't have a $590 deductible or lower, the insurance companies are going to pay some of that for you. And also some of those plans, the copays instead of percentages. For example, a tier 3 copay might be $47, for example. So it's going to be good for people and also not good. So Medicare, we are all estimating that 3% of the country normally shops every single year. We're estimating up towards 50% of the United States shopping their plan, whether it's because they lost their plan or because their plan is no longer suiting for them and their needs, and maybe their doctors left their network. The hospitals across the country are no longer taking that plan. So Medicare is individualized. It always depends on your state, your county, your zip code. There's so many variables in Medicare, which causes so much confusion and so much misleading information on this channel and other channels around the country because it's individualized. For example, there are plans on the Medicare Advantage plans that also suit snowbirds as well. It totally depends on their county, their zip code. For people that are RV traveling around the country, there's plans for them. When it comes to the different increasing costs of the Medicare supplement plans, those depend on the different states as well. When it comes to increasing, some plans increase more than ever nowadays because of the inflation, as well as people actually using their insurance. So there are many, many, many major changes happening here in Medicare, and it's so important to get help, whether it's a broker who had license for a majority of the plans in your area, or whether you get help if you have a person who helps you. That's what's important, is that for somebody who has technology and who is licensed with all the major plans or most of the plans in your area, so they can shop for you. We're very blessed with technology and knowledge. So different brokers have different knowledge for their areas. For me, growing up in the industry for over 50 years, my grandpa did this. He owned an insurance agency, independent, as well as my dad was a geriatric internist. He was a medical director of 2 hospitals. He also was a medical director of a regional plan in Western New York, and he is a consultant in insurance, and he helped create a Medicare plan in 2023. So each of us have a lot of different knowledge. It is going to be a very scary year. The number one thing as people get older don't like is change, and we understand that. So when I help people, we make sure people don't lose their doctors, people don't lose their prescriptions. They always get the best coverage because a lot of these doctors and hospitals take so much. But Medicare is so individualized, and that's why it's so confusing because each of us have our own bodies and we have different experiences in our family and different genes. So that's why Medicare is so confusing. So it's so important to get help from a local broker, somebody who's honest and trustworthy and has the knowledge and works also full time. So for us, Medicare and health insurance in general is 24/7. We have staff, and so we're always wanting to help here as well. But make sure it's so important than ever before to look at all the options that you have and just don't rely on that your current, whether it's your prescription plan, whether it's your supplement plan, whether it's your advantage plan, is the best needs for you. So I hope you have a great day and God bless.